So, hello everybody. My name is Volker Termöhlen. I'm the president of IAP, and my science background is medicine, pediatric, and virology. I welcome all of you who are so-called our audience. We are not seeing, but I hope you can hear us and that the technical connection is working so well that you can follow us and understand us and can see our presentations. We are here today to discuss the aspect of climate change and health from the perspective, more from a global perspective. And we do this under the chairmanship of the Inter-Academic Partnership. The Inter-Academic Partnership is a global network of science, medical, and engineering academies. Now, I assume that majority of you are not familiar what is IAP, and I will just use a few minutes to introduce this global network of academies of science, medicine, and engineering. As you can see from the first slide, we have about 140 member academies. They are globally distributed, and you see on the map that these academies are found in the Americas, in Africa, in Europe, and in Asia. And in these continents, these networks have also formed so-called regional networks in which they put these science and medical academies together to work in their areas and to give science advice to policymakers at home and to address important questions, social questions, which are important for the countries in which they are located. And these altogether are 4 regional networks, and you see the abbreviations, which I don't have to explain, but those who are speaking to you will do this. And altogether, we represent more than 30,000 leading scientists, engineers, and health professionals in over 100 countries. Now, what are our objectives and our priorities? Of course, we want to build capacity and empower regional networks and the local academies so that they are in the position to fulfill their goal as a learned society, but also to serve societies. And we are doing this by bringing and supporting the IAP's regional networks and help them to do their goal, which they have really put down as have agreed upon. We also communicate important science, engineering, and medical questions, in particular in the world of science, also in society, helping to define definitions of these different topics so that we can actually fight false information and give the scientific explanation to questions which are coming up. And what we also try to do is to build up a global network of competence that these regional networks are not only working in their region, but also working together. And this is a topic which we will discuss today. So I give you some examples of what ISP has done just during the last months. When the pandemic really started, we actually, as our academies, we have a group of experts everywhere, of virologists, of epidemiologists, of mathematicians, of public health people, of medical people, so that they can advise. So we put a group together of about 80 scientists from the different fields. And out of these 80 members, we have a group of about 20 members, which are doing the work and trying to compile the questions which are coming up and which are of importance and give answers to these questions so that everywhere where there is a national science academies, there is a possibility to address these academies in order to have, when you have a question and you will get a competent answer due to these big networks. Now, we also have done and have as headquarters together with our members made some communiques and some statement. So we made statements over COVID-19. And the first one we did was on, for example, on global solidarity on COVID-19 pandemic, because when we realized that in contrast to former pandemics or epidemics like HIV, like Ebola, or the first SARS virus infection, There was global political leadership and there was global science leadership. But this time, as you recall, there was everybody more concerned about his own problem at home rather than seeing the global perspective of this academy. So we published a document on this issue. We also published a document on the development and distribution of vaccine, a question which is right now heavily discussed. You know, who will get something? When should we start? As soon as we have something, and what are the conditions that a vaccine is safe? And these definitions were then addressed by us in a document which we published as IAP. And we also started already to discuss what will happen after COVID is going down and we come out of this COVID disaster, so that we made a communique and a statement on the global green recovery after COVID-19, using specific advice to ensure social equity, planetary and human health, and economic benefits. And you see on the bottom here, also on the left-hand side, that we also address, of course, fake information to make sure that the science information is distributed and available to everybody. But we also do something on the basis, for example, in education programs on food, or also together with the Smithsonian, we have started a discussion when Zika came up on the mosquito to give advice how in schools the education can take place to give the information available. Okay, and one of our aim right now is that these regional networks are not only working separately, but also working together. And a couple of years ago, we started a topic on food and nutrition security and agriculture. And you see here the reports, 4 reports produced by the regional networks. They accumulated the knowledge to important questions we had agreed upon and produced a regional report. And out of these 4 regional reports, we made a 5th report. In simple words, we try to find out why certain questions are actually addressed differently in the different continents, so that politicians who have to make decisions will understand why there is not a unified answer to a major question on this complicated topic on food and nutrition security. And what we are doing now is that we discuss in a similar way climate change and health. And this will be discussed with you. You have the possibility to ask questions, but we first will present these topics on climate change and health and how we have done it. And the first speaker who will now address this is Robin Fierce. Robin Fierce is the program director of ESAC, European Academy Science Advisory Council, a council which represents 29 national academies, all members of the European Union. And they have prepared a document on this climate change and health. And Robin will start, and Robin will now, as our program director, describe in general terms what we are doing, and also refer to the ESAC work we have done so far. So Robin, I think I have introduced you, and I just have to make sure that I clean the screen, and I will do this now. And you should be now in the position to do it. Can you do this? Robin, does it work?
Sorry, just hold on. Yeah. Okay. Can you see my screen? Okay. Can you all see my screen? Yeah.
Okay. Yeah, we see it.
No?
We see it.
Yeah. Okay. Yeah. I'm Robin Fierce. Following Volker's presentation, I will give you a little bit more background on the particular IAP project we're presenting this morning. I will illustrate some of the early outputs from that project with regard to what we've been doing in Europe, and I'll finish just with what we're expecting from this session. So thank you to the World Health Summit organisers for inviting this session, and thank you to our technical support who are enabling us to contribute. Okay, climate change and health is an important topic. It's being presented several times at the World Health Summit this year, including earlier this morning by in a session again co-organized by Andy Haynes. The slide you see now is taken from the US CDC to describe the multiple and complex pathways of exposure and the pathways from that exposure to some of the human health effects. This was discussed a little bit more detail by Andy earlier this morning. And we'll continue this afternoon in another session on climate change and health. There's a range of impacts, and indeed there's a growing evidence base for these multiple pathways and multiple impacts. So we're seeing a lot more evidence, but we're seeing a lot more political visibility on these issues. But there's still a number of priorities to pursue, which we are pursuing in this project. First, to identify and quantify potential solutions in order to tackle the health problems shown on this slide. Secondly, to focus on those who are most vulnerable, whether that's in terms of geographical territory or socioeconomic status or something else. And thirdly, the academies on behalf of the scientific and medical communities to build engagement with policymakers and other stakeholders across sectors and across the world. And this is what we're trying to do, help to do in the IAP project. As you heard from Volker, it's pursuing one of the key strategic objectives of IAP to engage with policymakers and at the same time build capacity in our academy members. As you heard in the introduction, this project draws on 4 regional groups in Europe, Africa, Asia and the Americas. The European report was published last year and in fact was discussed at the World Health Summit, last year. The other 3 regions are actively pursuing their work, and you'll hear about that later in this session. And following the regional activities and the regional reports, we will also in IAP be producing a 5th global synthesis report to analyse some of the issues at the global level and to bring together the regional activities in terms of similarities and differences. That's the objective. Obviously a lot of other groups are working on climate change and health. Some of these very large activities, not least the IPCC. So how do we envisage that any IAP work in this area would add value? We can capitalise on a number of advantages of attributes of IAP in terms of its inclusivity across the science base, integrating between the local, regional and global activities, developing recommendations for policymakers, engaging with other stakeholders and so on. And in addition, one other bullet from this slide, we put a lot of effort in following up at the local, regional and global levels through our academies and academy networks. And in doing that, we hope to share experience and learn between the regions, involve younger scientists and so on, as described in this slide. Well, that's obviously quite an ambitious project across a broad area and a broad regional area. In order to make it manageable, the different regions agree essentially a template for a common starting point with some questions that all of the regions are seeking to answer in their own regional academy work. Obviously, what are the main effects now of climate change and what might we expect in the future? And clearly there's a lot of heterogeneity among the regions. What might be the solutions in terms of adaptation to the effects or mitigating those effects? What do we need to fill knowledge gaps in new research? What are the issues for vulnerable groups? How can we link our different levels of activity? And how can we link our activities with other key policy initiatives specific in the area? And I mentioned IPCC and also, of course, the UNFCCC, but more broadly with Sustainable Development Goals. Okay, so as I said, the ESAC report was published last year. We've been active over the last year in engaging with policymakers in Europe and elsewhere. I don't have time, obviously, to discuss this report in detail. It's available on the web and in print. I list here some of the main messages that we developed. I won't read them out. You can see them for yourself. Clearly, some of these might seem rather general in nature, but one lesson we've learned from our policy work is it is important to continue communicating headline messages to policymakers and to others, other stakeholders interested in the topic. And in this particular area, and this came up again in an earlier session today, it's important to use evidence to counter misinformation. There is deliberate as well as inadvertent misinformation in this area. And I think we have a continuing responsibility to contribute our messages, both at headline messages shown here and in detail. And of course, there's a lot of detail in the ESAC report that I just mentioned. I won't go into that detail, but I'll just illustrate one example from our European work, which we think is broadly relevant worldwide. And that's the relationship between agriculture, food systems, climate change, and health. As many of you will know, agriculture itself contributes significantly to greenhouse gas emissions and climate change. About 30% of total emissions worldwide. High proportion of that comes from animal-based foods and livestock in agriculture. We clearly need to have an objective of reducing agriculture's contribution to greenhouse gas emissions if we have any possibility of reaching the overall targets for greenhouse gases and climate change. And agriculture must play its part. Probably requires a combination of measures to change agricultural practice, to reduce food waste very much, to change farming practices, and probably to change diet. That is to reduce the contribution by livestock and dairy to climate change and greenhouse gas emissions. If we were to change excess consumption of calories and excess consumption of meat, where that occurs, then we do have a prospect of reducing greenhouse gas emissions, but also we have a prospect of bringing health benefits through a reduction in obesity and some of the non-communicable diseases. It's easy to say this, but rather more complicated to achieve, and certainly in discussions on modifying diet, modifying consumer choice, we need to engage with the consumers and to ensure that we protect vulnerable groups when advocating dietary change. So that's one example that we discuss in our report, and I know is of interest to our other regional academy networks. Just to finish on the European side, we developed a number of general recommendations for policymakers, exemplified in our report in various ways. That is a priority to do more to link the outputs from science and the development of policy, to communicate about the problems, particularly to counter misinformation, as I've already mentioned, to use the evidence already available, and to ensure that health is part of all policies in this area. That is policies for agriculture, of course, but also policies for the built environment, and so on, health in all policies. And in addition to using the evidence already available, clearly there's a large research agenda to fill knowledge gaps, so that we can use our new knowledge to continue informing policy. I will just finish on the European side to mention that since we published our report last year, we've continued to be active in several respects. One is to look at some of the issues for the Arctic, obviously global relevance, but also of European relevance, and in particular the prospect of emerging microbial threats from permafrost thawing. The other activity that we're continuing in Europe is in the Mediterranean and the Middle East. I noticed already one question about the Middle East area. We are currently engaged in an initiative with our Cyprus Academy to look at some of the issues of the Eastern Mediterranean and near Middle East. So that's ESAC. Just coming back to the bigger IAP project, these are our project objectives in terms of developing the regional and the global report. Our particular focus is not just to describe the current changes, but to consider how to find solutions to tackle those changes in climate. And when finding solutions, how to share good practice between the regions. This is my last slide. The next three presenters will provide material from their own work and their own working groups in Asia, the Americas and Africa to give you an idea about the emerging conclusions from their work and the particular focal points that they're prioritizing. The purpose of this session is additional, however, to seek your feedback from around the world on what we're doing so that you can help to inform the project as it continues over the next 12 months. In order to stimulate that discussion, all three presenters have been asked to consider three particular questions. These are listed here, and I hope that these questions will also help to support our general discussion when the panel has finished presenting. So thank you for listening to me. This is the end of my presentation. I will now stop sharing my screen and hand over to the next presenter, who I think will be introduced by Volker again. Thank you.
Thank you very much, Robin, for this nice summary of the activity of the European side and describing our entire network in the way we are following up climate change and health. The next speaker will be Professor Abdullah. Professor Abdullah, his background is medicine. He's president-elect of the IAP Regional Network in Asia. This is the largest network we have of about 38, I think, national science academies in Asia. And as you know, Asia is such a huge continent, and this is very difficult to unify everything. But from these existing science academies, the project of climate change and health is addressed. He's also Dean of the Faculty of Medicine and Vice Chancellor of the most important university in Malaysia, from Kuala Lumpur. And Carol, please go ahead and present your findings.
Okay, can I have the first slide, please? Okay. All right. First of all, I'd like to thank a couple of people. Number one, Professor Walter, and also Professor Andy Hines, who is the co-chair of IAP, and also Professor Yu Han Kim, who is currently the president of AASSA. And I also need to thank Professor Dr. Robin Pierce, who has been with me for a couple of months now, working with us and putting these things together. And thanks to Johanna as well, and she has been very helpful. So I'm going to start my presentation. The objective of our research that is in Asia is to analyze the respective situation on climate change and to produce science-based recommendations for the region. And number three is to highlight the similarities and differences, providing advice on climate change and health for implementation of global and regional sectors. Next. All right, we divided the various sectors into different areas. Asia is such a broad area as what Professor Walker just mentioned just now. So can you click the Asian report? Number 1 is the Oceania, Australia, New Zealand. Number 2 is Asia, comprising China, Japan, and South Korea. And Northern Asia, which is Russia, the Far Eastern Russia. And Southeast Asia, comprising Indonesia and Malaysia. Southwest Asia, the Turkey. And we have West Asia, which is of course includes Armenia and Azerbaijan and so on. And of course, the Southwest Asia, which is composed of India, Pakistan, and so on. And you can see the different people who are involved in preparing the country reports. Next slide, please. All right. Some of these wordings are not clear for me. Okay, maybe I can push this out. The country reports prepared for, actually, these are the following countries: Armenia, Azerbaijan, China, India, Indonesia, Japan, Korea, Malaysia, Nepal, New Zealand, Pakistan, Russia, and Turkey. Valuable resources for national discussions and to provide evidence for synthesis of AASSA regional report, which is in progress right now. The focus on vulnerable groups is on elderly, children, migrants, indigenous groups like Maoris in New Zealand, and the megacities have been given emphasis. Individual reports amplify heterogeneity within the countries across the region. In aggregate, show increasing impacts of climate change on health. Observation: we need to take a systems approach to develop solutions for mitigation and adaptation and to identify barriers to implementation. Implication of COVID-19 is also addressed at one point. Next slide, please. The change and health in AASSA country report, our observation, Asia is a disparate continent with extremes of climates from high elevations and below sea levels as extreme cold to desert conditions. And therefore, a variety of health effects from climate change is expected. Almost all reports have shown links to previous published policy and scientific reports on health effects from climate change from each country. Of course, some countries are relatively less affected to those, while others are severely impacted. Next slide, please. Preparing the regional synthesis report, the main areas that we have included is the introduction, the starting points for this project, and what are the major health effects, and what are the main adaptation and mitigation policy options available, and conclusions and recommendations. Next slide, please. The multiple pathways and effects of climate change on health: direct heat effects on cardiovascular system, indirect heat effects on labor productivity, flooding, infectious diseases, leptospirosis, dengue, etc., air pollutions due to burning of forests and pollution, infectious diseases, tick, dengue, and many other infectious diseases, including pathogens and migration of vectors. This is very important, migration of vectors and pathogens from neighboring countries which never had those infections before, mental health, allergy, and food and nutrition security. Example, childhood stunting. Childhood stunting has been observed in at least in 6 or 7 countries, and it is quite severe. Next. All right. The air pollution is again a major public health burden in many AASSA countries. Sources of air pollution, including from elsewhere in the region, fossil fuels for energy, biomass used indoors for cooking, wildfires, agricultural practices has been the main cause, and the health co-benefits of mitigation is reduction in greenhouse gas emissions accompanied by reduction in pollutants, example, particulate matter. Examples of solution or case studies in the country report: increasing public transportation, prevention of forest fires, and Pagoda Solar Park in India. Next slide, please. Now, this is the report that is being prepared by the Asian group, has got 2 case studies. The number 1 case study is about bushfire, and bushfires have adverse effect on people, physical and mental health. Individuals are affected by direct exposure to flames. Prolonged and widespread nature of bushfire resulting in more people being affected, and the scale and intensity of the 2019-2020 fire seasons in Australia presents an opportunity to address the knowledge gap that exists. Next slide, please. Now, flooding is also an increasing problem in Asian countries. Sources include sea level rise, extreme weathers, excess precipitation and river flooding, and melting glaciers. The multiple consequences are short-term, waterborne and vector-borne diseases. Long-term is degraded ecosystems, health impacts and so on, and economic impacts like in Turkey, for instance, we observed this before. Examples of solution or case studies in the country: cross-sectional approaches to planning for environment, Sindh barrage across river Indus in Pakistan, and restructuring health facilities affected by flooding in Malaysia. Next slide. The Malaysian flood case study, a series of extreme weather events in Asia Pacific region, is a result of ocean warming and heavy rainfalls that has occurred in recent decades. The unprecedented yellow flood of late 2014 and 2015 is a recent example of extreme weather event that had occurred in Malaysia in 2018 in Indonesia. Large number of families had to be moved, and maybe we'll discuss this later. Future rainfall trend over the next 50 to 100 years has been predicted will only increase. Next slide, please. Now, continuing analysis of cross-sectorial solutions and sharing good practices across the region, mitigation co-benefits for health by increasing renewable energy, urban planning, reforestation, and green space provision, changing agricultural practices. Adaptation in health sector includes integrating local national actions strengthening of health services and infrastructures, public awareness and education, early warning and surveillance systems, and control of infectious diseases. Ensuring linkage of climate change and health issues at national level and at regional level through the SDGs. Next slide, please. Now, a very exciting and interesting observation that we have made. We have found a total fertility rate, a decline in the total fertility rate. We look at 1957 to 2018, that fertility rate has gone down all the way from 8 to 1.8. And this we are now has been published part of the work, and it is actually controlled by physiological changes that are brought by climate change. But since the time is limited, I'm going to just say that the total fertility rate has reduced. Next slide, please. Can you continue with the, oh, I had one more slide. That is, I'd like to thank certain people. Can you go back to the slide before this, please? No, after this? All right. I like to actually thank Professor Ravi and Professor Victor and my team workers, Mr. Azman, Ms. Aini, and of course, like not forgetting Ms. Mogwitz, who has been very, very supportive in not only preparing this, preparing our reports. Thank you very much.
Thank you very much, Carol, for this presentation in which you have described quite nicely the state of the art in which your activities right now actually are. So I think we continue because questions will be then moderated later by Sir Andrew Hines, and the next speaker is Professor Jeremy McNeil from Canada. He is president of the North and South American Regional Network of IAP. He is president of the Royal Society of Canada, and his background is a chemical ecologist, and he is a very gifted photographer, I can tell you. When he watches insects, you will be surprised to see his pictures. I don't know whether he will show any, but if you will see them, they are beautiful. Okay, Jeremy, you have the floor, please.
Thank you, Volker. It's a real pleasure to be here. As you can see, my name is, as you heard, my name is Jeremy McNeil. I'm an insect ecologist, and I represent today IANAS, which is the Inter-American Network. And as you can see in this graph, it represents over 25 academies and associations throughout the region. And, okay, all of a sudden, okay, that's it. I would just like to present the other members of the steering committee here. As you can see, they're from North, Central, and South America. And can everybody see that? I can hear somebody speaking that. Okay, these are the representatives, and as you can see, they vary considerably in expertise. And what we have done is contacted each of the academies, asking for case history, specific points that we can include in our report. Obviously, within the conceptual framework, as Robin mentioned earlier, there are many other ongoing activities. So rather than reinvent the wheel, we've made very sure that we've taken into account the various organizations that have produced reports to take these to include in our framework. And of course, we're working as part of the IAP initiative based on the original ESAC report. Now, you know, this is a picture of Mexico City, and you can see the air pollution, which obviously has direct effects on health, and in return with the cycle is also affecting climate change itself. And I could just actually say, you've heard everything I'm going to say from the previous talk, because we're all facing the same sorts of things. And one has to immediately think, as it relates to health, the extreme weather events that have a direct effect. And we've heard about flooding, we've heard about droughts and very high temperatures. Interestingly enough, this is Hyde Park, where it should be only mad dogs and Englishmen go out in the noonday sun. It was just so hot and dry, nobody was out there. And I did find it ironic that the two pictures I chose were from Britain, even though I'm a Canadian. The other thing is, of course, with these extremely dry and hot weathers, we have the effects of fires that was already mentioned. We have them in California and Canada right now. And it's not only the direct effect that it can have on life itself, but the pollution problems and, again, feeding back into climate change itself. But one of the other things that we all have to deal with are the indirect effects. And it's been referred to as it relates to food security, and that gets into agriculture, which is extremely important to have good agriculture from a health point of view, but is also a problem as it relates to climate change, as Robin indicated. I could argue here that as an entomologist, changing diet, we feed our children worms, and this is a flower beetle larva, but most people would object, and there may be allergies related to that, but we definitely do have to change the way we do agriculture. But even if we consider traditional agriculture, we have serious problems that arise because of climate change in productivity in agriculture. You can see here, it's always very pretty. You go out, we have these unusual storms here, and very early we get frost. You can go out, take very nice pictures like this one. But the problem is, if we get them at certain times of the year, for example, during flowering of an important fruit tree, if this occurs at a given time, we can actually lose 80 to 90% of the crop. This happened several years ago in Canada, where I live, where 80% of the apple crops, and in some cases 100%, were totally destroyed by a very unusual frost that occurred much later than one would normally predict in olden times, if you like. The other thing is, how soon can you get into a field? How soon can you actually go and harvest? And in many cases, we have lost crops because we don't have enough time to actually grow the crop, or it's doing well, but we cannot harvest in time and it stays in the field because of weather conditions. It can be drought, it can be rain, et cetera, et cetera. The other thing, of course, which is dear to my own heart, is the question of how the impact of climate change affects the natural enemies in agriculture. And one of the things that I work on are migratory insects that can move very long distances from one country to the other. And this one is the fall armyworm, which is a New World pest, which is now a major pest in Africa and Asia, and is spreading considerably because they can move over 1,000 kilometers or more very, very quickly. And depending on changes in weather patterns, we can get some very different infestations. The other aspect that one has to consider, of course, are the beneficial insects. And we've heard about the decline of bees throughout the world. And part of that is certainly related to climate change, amongst other things. And without it, we would have a serious problem in agriculture. And of course, it's already been mentioned, all of the diseases, the vectors that transmit many of these diseases. We saw, Zika, chikungunya, et cetera. And in fact, one of the special documents in the Americas is one looking at the effects of climate change and dengue in several of the countries. We obviously are basing, in many ways, our report on the European report because we want to continue as it relates to the policy options, obviously, and using case histories that cut across themes and bring key messages. Obviously, we're going to cut down the background section because it would be repetitive, but we want to put a greater emphasis that is being brought up in a number of sites now on the impact of climate change, both direct and indirect, on mental health. And for us, of course, it's a section on indigenous peoples, and I will come back to that. focusing on the intersectionality. It isn't just one thing. It's, you know, it is interconnected. No man is an island, so to speak, with respect to John Donne, and putting a great deal of emphasis on equity, because throughout all of this, and with things like the COVID-19, we are seeing that it is not an equal society. And one of the examples, of course, for us, as I indicated, are the indigenous peoples of the Americas. And this is a report that came out very recently, looking at a health survey of the indigenous peoples of Canada. And a major problem is the question of climate change and how climate change is affecting them, both in terms of their survival, how it affects the water and so on and so forth, but also how it affects the availability of their normal and natural food sources that they've been using for hundreds and hundreds of years. We're not talking about modern agriculture. And also how it affects their ability to actually get food into the area. And we have aspects like this where there is melting of ice that should be remaining. There are areas that normally freeze that do not freeze as intensely or for as long. And this, as I said, will affect the availability of the plants and the animals that were normally used traditionally. And secondly, of course, in northern Canada, ice roads are extremely important. And they used to last for up to 6 months, where trucks could go in and deliver goods, because this was about the only way of going in, because it's way too expensive with air. And now these roads are actually only lasting for 3 or 4 months, which increases problems of food security. So basically, we want to start at the very beginning, where we're putting a foundation, a conceptual framework early, so that the readers are in a position to know exactly what they're getting into. And we will have 3 parts: the climate change impact itself, which will be an overview, and of course we'll cover many issues that are similar to all of the other regions. This is not surprising. We will look at the response options, which of course will vary depending on the region. It will depend on a number of aspects, you know, financial, et cetera, and we will make clear recommendations in the context of considering who the audience that we are actually writing to is going to be reading this. And we want to make very sure that we have a series of cost-cutting themes that bring into it, as you can see them on the screen now, of intersectionality, coupling socio and ecological systems. We have to take into account indigenous knowledge, looking at what is local, regional, and what is international. Basically, our key messages are that we want to emphasize is it's impacting us now. It's going to get worse. And if we don't move now, we have a problem. And this actually is one of the reasons, this idea we must act now, as you probably heard with many young people, they are really, really concerned at the mental health level of the impacts and what I'm going to have in my life when I grow up. I put this in because it's habitat destruction. And of course, as an ecologist, one doesn't like this. Very frequently, it's done for agriculture. It in unto itself has negative effects. But I think one thing that's coming up, particularly on several of the, from several of the academies in the Americas, is that these activities are bringing us more, and we're destroying habitats that are very important from biodiversity and from the climate change perspective. But we are then encountering more and more, increasing the probabilities of having diseases come from other organisms in, as in the case of COVID-19. We really have to think about this in our activities. So on that, I would like to thank you. It's a very short overview, but we are working along very similar lines of the others, taking into account both our local, regional, and international perspectives. Thank you very much.
Thank you very much, Jeremy. In particular, your last photograph is beautiful, right? It gives us an optimistic view in any time. Okay, Thank you. I think we move on now. And the next and the last presentation is by Dr. Karedi Wright from South Africa. She is a member of the African Young Academy and from the Global Young Academy. So she reduces the average age of our presenters. And she is presenting the African group there. And just to give her time for information, to give you some information, she's a scientist of the South African Medical Research Council, expert in climate and health research, and a social professor of the University of Johannesburg. So I'm very happy, and we are very happy that she has joined us, and she will present now the view of Africa. Karedi, please start.
Thank you very much for that wonderful introduction. It's an honor to be in the presence of all of you today. And I'm presenting on behalf of the Network of African Academies. So this presentation has been put together by several people, not just myself. So Africa remains one of the most vulnerable continents when considering the impact of climate change on health. That's why the principal objective of our report, as we are following the examples of the others and using the ESAC report as our guide, is to try and assess the status and make recommendations that African governments should consider when dealing with climate change and resilience in Africa. We see it having 4 project objectives. So assessing status and making recommendations on climate change and resilience in Africa, review evidence on climate change and health impacts in Africa, consider and assess adaptation and mitigation strategies, and then really focus on developing solution-based recommendations for intervention. Here I'm showing our project lead, who is one of the participants on this meeting today, Professor Dheeraj Kasi. But we also have a very large team from a number of countries on the African continent, and we're also supported by NASAC members from these different countries, and there'll be an external peer review process throughout the compilation of our report. The current report comprises 5 main sections: the introduction to the challenges of climate change with particular relevance to Africa. It's a bit of an overview of what the project is about and how it links to the other projects in the different regions. And then we dive into the known major health effects of climate change, and we look at these from a current, future, and including recommendations perspective at the health outcome or impact level. Again, as been mentioned just now, we are not only looking at the direct impacts, but also trying to consider the social and environmental determinants of health, our clean air, safe drinking water, sufficient food, and secure shelter, which are key elements in Africa requiring attention. We're also thinking about this from an ecosystem change perspective, societal change, and economic change. And then we have a very important section on vulnerable populations, not only in terms of age groups or people with pre-existing diseases, but also looking at it from a regional perspective, given the size of Africa and the different challenges being faced across the continent. We then consider what are the main adaptation and mitigation policy options. We do this by looking at what is existing. So for example, looking at the national action plans that are submitted to the UNFCCC, but also looking at other case studies and approaches to adaptation and mitigation, and really digging in to see whether their effectiveness of implementation goes beyond just implementing an intervention, but actually has a positive impact on health outcomes. Then of course, we'll lead towards some conclusions and recommendations and try and use that evidence base that we find for developing solutions. I'd now like to turn to just 3 highlights from the report, which are also focusing on the similar issues that the other regions are facing. So these plots, some work done with a colleague of mine, Rebecca Garland, and others. It's a little bit old now, but the data I would imagine is still relevant, We're looking at the number of hot days across Africa and how they change across slices of time between 1961 through to the end of the 21st century. And essentially what it's showing is that the projected change in the number of hot days, in this case defined over 32 degrees Celsius, is really increasing mostly in the southern parts of the African continent. From a public health perspective, it's very important that we take this type of research and translate it through research translation into materials that can be used by the public. For example, the flyer, which in this instance is in English, but is available in other languages, that talks to what can people do when they are experiencing heat waves. We are actually experiencing one right now in my country, in South Africa, and where should they go to seek help? The second example has also been mentioned about heavy precipitation and floods. This is just two examples of illustrating an increase in heavy rainfall and flooding in different parts of Africa. I had a very interesting conversation recently with my daughter. She was preparing an oral. It relates to something that Professor McNeil was saying, that, and also relates a bit to what was mentioned in the beginning about misinformation. Are these disasters or changes Earth's way of restoring balance to the system? And in fact, I think that's misinformation that we need to get out to the public, that is not true. We need to be taking action as individuals to prevent these types of events, which have enormous consequences on health, on infrastructure, and on economies ourselves. The third example is also something that's been seen in other presentations, the enormous challenge of household air pollution in Africa. Around 600,000 annual deaths are attributed to exposure to indoor or household air pollution. A much larger number of people suffer from related acute and chronic respiratory diseases. The example on the right is a case study that it was a cohort intervention-based study that unfortunately got an anti-intervention of COVID-19 and halted my intervention, which would have been looking for alternatives for cleaner indoor environments, cleaner stoves, cleaner heating devices, ceiling installation with insulation, solar cookers, for example, such as Wonder Bags, and other ways to try and keep households within their means of what they can afford to create cleaner environments in which they can reside. The final example is looking at climate services for African agriculture. It's really important that we look backwards to plan forwards. The key elements here is that it is critical for us to have access to data. Data in Africa is oftentimes very difficult to come by. We want long-term data sets of meteorological data as well as health data. And oftentimes those health data are not digital or electronic, they are handwritten. Some of the key elements here for African agriculture climate services is working hand in hand with farmers and the agricultural sector, including indigenous knowledge and know-how, thinking far more holistically about health impacts, and this has already been mentioned across the spectrum of insecurity, food insecurity to stunting and malnutrition. It's also very difficult to overcome some of the uncertainties in the modeling for rainfall projections. And essentially, we should be working together to co-produce the solutions that are needed. The report is going to put together a number of draft recommendations they're draft at the moment. They'll be more confirmed with the evidence, but they'll cover all of the key topics that we've identified as health challenges related to climate change in Africa. I'm certainly not going to go through all of them, but I'd like to highlight two. First of all, zoonoses facing currently the COVID-19 pandemic. And there's certainly the need, if we look at the UNEP Frontiers report, to embrace the One Health approach. The other example would be household air pollution, where we need a far greater focus on clean energy interventions, not to stop at just measuring whether the air quality changes, but assessing long-term whether health improves over time. In conclusion, climate change is really the defining issue of our time, and now is the defining moment to do something about it. It is so true that young people are standing up, including my daughter, to take action to make a difference, to ensure that their futures will be safe and for their children too. Thank you very much for the opportunity to present today, and I'm very pleased to have been part of this session. Thank you.
Thank you very much, Karidi, for this wonderful, nice information and summary of the activities in Africa. And I think we are coming now to the part in which my co-chair, Sir Andrew Hines, will take over. He will moderate and he will sum up to some extent, I'm sure, and he will answer also questions. Andrew, I don't think I have to introduce you. Everybody knows you. You are, the Emeritus Director of the London School of Hygiene and Tropical Medicine. You are one of the persons with the strongest involvement I know of international research on the topic of climate change and health. You belong to so many expert groups, WHO, Lancet, Planetary Health, etc. And you are involved in almost all international big activities of climate change and health. So we are very happy that you are part of our group and that you help us, that we will get at the end such very nice documents published on this issue. Thank you, and please take over, Andrew.
Well, thank you very much for involving me, Volker, and thanks, colleagues, for wonderful presentations. And I think that's also going to stimulate a lot of interesting questions. So what I'm going to do before trying to sum up is to talk about or ask you about some of the questions that are being posed by the listeners. And I'm going to start off with the one from Megnath Dimal, and she asks about the issue of gender and how gender issues are often sidelined in these kind of reports. So maybe, Karidi, I could turn to you and say, what are you planning to say about gender issues? Because climate change is not gender neutral, as we know, and many of the solutions and problems are experienced differently by different genders. So I'd just like to ask you to comment on that.
Absolutely. Thank you very much, Sir Andy Haynes. This is an honor to be able to speak with you in person. I certainly think gender issues in Africa are an enormous challenge and something that we're going to have to consider in our reports. I know, for example, household air pollution is adversely skewed effect on women and children. So the interventions that we install or consider need to really be ones that can be taken up by the primary caregivers and those who are looking after children. So gender is definitely an important issue, and that's just one way I can think of that we'll be considering it.
Okay, thank you. Another questioner, Anurag Saha, wants to direct a question, particularly to Khairul Abdullah, particular focus on the statement that you made about the total fertility rate declining and that climate change was somehow implicated in that. But the questioner asked, well, isn't it also due to changes in contraceptive practice, education of women, and so on? So maybe you could just respond to that question, Khairul. You need to unmute yourself. Can you unmute yourself?
All right.
Good.
All right. This fertility rate that has been observed to kind of a decreasing over the years from 1957 until now. And there are now evidence that are available showing that climate change is actually changing the physiology and the pharmacology of the reproductive system. But I don't think at this point I can give you details of the findings, but because the person, we will have more written about it later on, but it is an early finding that I reported just now.
Okay, thank you. Let me pose a more general question, which you may wish to answer, or others as well. And that is from Aruna Dahal, particularly around health systems. So how can we create more sustainable, resilient health systems which are able to tackle emergencies that arise from climate change or other factors? What sort of approaches do we need to take? Is it a patient-centered approach, a value-based healthcare system that carefully monitors indicators that are exacerbated by climate change and implements solutions to address those? So maybe I could ask for responses to that question about how we create a more sustainable and resilient healthcare system. And by the way, one thing that didn't come up, but I think it came up in our previous session, was that the healthcare system is responsible for about 5% of global greenhouse gas emissions. So if the healthcare system was a country, it would be about the 5th biggest emitter, something of that order. So we do need to get our own house in order. We need to reduce the environmental footprint of the healthcare system, as well as creating more sustainable, more resilient healthcare systems which can respond to shocks. So I don't know who would like to take that one, but whether Karadi or Carol or anyone else.
Maybe I can just briefly kind of, I may not be able to give a very an answer to your question. Your question is very important question, and it's a question that involves multiple areas of involvement. If you look at the health system, for instance, health system of any country, if I'm looking at Asia alone, we have about 40 countries that we deal with, 43 countries. That is in our group, Asia. The health system is different from country to country. And the health system is very much influenced by the economy of the country as well, and the priority that is given to the health system. So it is very difficult to define a health system for the whole Asia. But what is optimal is what probably we would be working towards. And how optimal when you're talking about a climate change and health? Is it like an infection that goes through a country and how the health system should be? Or is it an effect of the climate change? So these are issues that we need to define first. But basically what is required is the awareness. I think I'm coming back slightly deviating from the point. The awareness that we have not actually, as a climate change, is not actually something that everybody knows in the country. And it's worse in some countries. We pass through and ask them about climate change and health. They have, first of all, they don't have any idea what is climate change. Number two, you're talking about how it affects the health, and nobody understands what's going on. So, and this is not a small percentage. It's about 70 to 80% of the population of a very well-educated country. For instance, if you look around in Asia, Singapore, Malaysia, Thailand, and some countries which has got good economy, but they have no idea. And I think this is something that we need to champion, this idea. And everybody has to feel the importance of climate change and how it's going to affect health. And we need to impress upon the population. And maybe, of course, to the politicians, the stakeholders, and everybody. Right?
Thank you very much. That's good. Well, I think you've very clearly made the point that we need to reframe climate change as a health challenge rather than just a challenge or threat to the environment, because that doesn't motivate change, unfortunately. Karoli, let me turn to you. Do you want to add anything about resilient low carbon health systems?
Yes, thank you. So first of all, we've been discussing, I'm an author of the IPCC AR6 Africa chapter, and we've been discussing the concept of going back to basics. So every country in Africa has a different health system. But if that health system is broken in the first place, it's impossible to be able to meet the needs of the people, never mind trying to transform it into a environmentally friendly health system. So going back to basics doesn't necessarily mean having to go back to what we were thinking 20 years ago. We could actually leapfrog that and move forward and do it in a different way, perhaps learning from other countries where it's going well, and create systems that work better than the basics and how we would have done it many years ago, and end up with a more lighter tread of the health sector on the environment. So one of the things, for example, that we've seen with the COVID-19 pandemic in South Africa is the very first that I'm aware of track and trace app. And this has worked extraordinarily well. And I never thought that something like that would work. Most of our health data is paper-based, and for the very first time, we've been able to implement that in our health system. So that's leapfrogged from paper to computer to smartphone. And I'd like to see more of those types of initiatives. We can do it. It does take an enormous amount of collective support and energy and interest and convincing, but it is doable and I think actionable.
Great, thanks very much. And I would just add really that one of the things we've lost the focus on a bit in health systems is primary care. A lot of emphasis goes on tertiary care, high-tech hospitals and so on. But really primary care is the basis of the health system. If you don't have a proper primary care system, whether it be through family practitioners in high middle income countries, or whether it be through community health workers or some mixed approach, then you can't really effectively deal with some of these burgeoning public health problems. And that's where you get the interlinkage also between the public health, primary prevention, and the clinical medicine, the basic treatment. So I think we need to foster and strengthen the primary care system in many countries and integrate primary care and public health more effectively, and that will help us to create more resilient and also lower environmental impact health systems. Let me move on to another interesting question from Frederick Dunn Day, if I've got the name right. And he asked a very interesting question about the fact that because of the climate emergency, and we don't quite know how to rapidly stop climate change at the moment, where things are not moving quickly enough, that some people are advocating global experiments, for example, of putting aerosols into the geoengineering, trying to cool the climate rapidly. And so he asked, is that something we should be frightened of if these experiments occur at a large scale? And someone else poses the interesting question is there an ethics body that would regulate some of these global experiments if they are proposed? And that's an important question, which I think we haven't really given sufficient attention to. I mean, you could argue that climate change in itself is a global experiment, something we're actually doing to ourselves. We are experimenting on the planet and with our own lives in an uncontrolled way. But there is this big question about these very bold and controversial experiments that are being proposed around geoengineering, for example, and how should we address those? Does anyone have any views? I mean, Jeremy, could I perhaps turn to you for your thoughts on that?
Well, as many, having run many experiments with what I thought was going to be the outcome and getting something totally different, sometimes better, sometimes not, I'm always a little concerned about these. And every time you see it, there's nearly always this is why it's going to work. And then there are the underlying, well, if it doesn't, what are the problems? I mean, we're really shooting in the dark. I mean, that, you can't take it back once it's out of the bottle, or, what is there? You can't put the toothpaste back in the container. I mean, it's reaching a point, I suppose, in one sense, that if we are not doing the small steps that we could be doing that would slow it down and be acceptable, we may be at a point where it's going to go boom anyway, so we might as well intervene. It would be much better if we were able to get everybody to act right now on the steps we know are good, rather than taking the big risks, but we may end up having to.
Yeah, and if we do, then the question is what kind of global body will pronounce on whether those kind of experiments are the appropriate ones, since they may be undertaken at a regional level or even a global scale.
But the problem is, even if it's undertaken, if we agree it's only going to be in one region, we've already seen what happens at one side of the world has an effect on the other side. So even that is a, open experiment in and unto itself.
And that's, I think, a big challenge, I think, to the UN system, and something maybe we ought to feed up to the UN system as a whole, to think about how to address some of these questions which are going to come up, whether we like it or not. I want to move on to another question from Silvia Berenice Quintana, and she raises the issue which we haven't talked about in detail, which is about nature-based solutions to tackle climate change and health. Now, nature-based solutions are being increasingly promoted. Solutions like protecting ecosystems, reforestation, preventing deforestation, protecting wetlands, mangrove restoration, for example, green space in cities. So there's a lot of interest at the moment in nature-based solutions. And I'd like to ask the speakers, the panelists, which they think are the most important ones, particularly with their view of their potential beneficial effects on human health, and what we can do to evaluate better the potential benefits from nature-based solutions. But of course, as with everything, there may be disadvantages too. So for example, if you create wetlands close to cities and they become breeding grounds for mosquito vectors, they can cause increased disease. So we also need to think about designing nature-based solutions with health in mind. So let me turn to the panelists and ask them whether they have any views about that. Robin, do you want to come in at all on that?
Well, I was going to use the example you just said about beware of inadvertent consequences, which I think raises a general point that I mean, I don't know which are the best or the less good nature-based solutions, but whatever is being proposed, it's necessary to take account of health impacts, and to some extent, planning in a number of these other sectors still doesn't take sufficient account of potential consequences for health. So I think that's a potential key issue. Clearly, there are number of opportunities providing green space in cities, obvious one that need to be progressed alongside other aspects in urban planning. Agroecology in agriculture, that might be another potential nature-based solution. I think there is sometimes skepticism about the level of a science base providing evidence for some of these nature-based solutions. I think we do need to ensure that it's rooted in the science, and I guess that's the other general point that I'd make.
Okay, thank you. Reflections on the nature-based solutions issue?
Well, one thing we've emphasized I mentioned indigenous knowledge, because they have, in many cases, people have been living in environments for a very long time. And when we say it's not science-based, it wasn't published. However, very frequently it is based on observation, repetition, and transfer of information. And we need to go back and realize that there is an awful lot of information that could be used intelligently and not just written off as, oh, it's myth and everything else. Very frequently, the stories are told like a myth, but the underlying observations and repetition, as we do in what we'll call Western science, exists. And I think if we are looking at that, we really do need to pay attention to the knowledge that is there by people who actually have lived face to face with the system. I mean, most people eat fruit, they wouldn't know what the plant looked like that it came from. Many of us are totally disconnected from nature. So I would rather, if we're going to do nature, let's talk to people who know nature.
Absolutely, and we know that many of the most biodiverse areas on Earth are actually the custodians of the indigenous people.
Exactly.
Of course, in many parts of the world, they're under threat and they're being abused and harassed and so on. So there's also an issue of human rights and how the science community and indigenous knowledge can work more closely together to safeguard some of those natural and human resources that we have. So let just raise one more specific question from the Q&A before we ask the panelists to make concluding remarks. And that's from Pia Henkel. She mentions the importance of including younger generations and how will the IAP project make sure that these young voices are heard. Maybe she's looking at the mean age of the panelists. I don't know, and she's too polite to say that, but I think she's got a point. So IEP, how are the younger voices, younger scientists going to be involved? And they'll be the leaders of the future, of course, so very important to engage them. Okay.
You know, you see, in IAP, we have accepted the Global Young Academy as member of IAP, and they are very active and they are included into our activities. And more, I think we all realize we have to include the younger generation, the younger, you know, the presentation by younger scientists, as Carrie D has shown to us today. And I would say this is something which we are really supporting a lot. And it is a pleasure to see that young academies in countries are growing, and that even established academy like the National Academy of Sciences finally has agreed to have a so-called young academy. And you know, that started about 20 years ago in Germany between the Berlin-Brandenburg Academy and the Leopoldina to do this experiment. And of course, in the beginning, there was a lot of resistance because all the elderly colleagues were objecting, and it's impossible, you know, it can only be those who are emeritus, they can do it, not the younger one. But it is turning, and there's no doubt that the younger generation will take over eventually. Yeah, so I'm quite optimistic that this will work and will be much better.
Carrie, did you want to chip in at all there?
No, I think that hits the nail on the head, that I'm seeing a lot more synergies and work and collaboration between the junior and the senior academies and countries. And that's extraordinarily promising because the younger generation academies are actually better connected with the youth, especially when they're doing social outreach. It's bringing them in as citizens, because citizen science is also really important. So yeah, I'm in great support, and I know that the GYA is extremely grateful to the IAP, so thank you.
Yeah, it's great to see, I mean, many younger early career colleagues really stepping up and showing great interest and commitment to this whole field. I also think that some of our younger colleagues are much better at bridging the disciplinary divides, because many of us were brought up in fairly narrow kind of disciplinary silos. And the way forward at the moment is to work in a transdisciplinary environment, transdisciplinary context, which means learning the languages of different disciplines. And, you know, we're all learning together, in fact. So it is a tremendous opportunity. And I think many early career scientists are really exemplifying that in their personal careers. What we need now, of course, is the research hierarchy, the research funders, to also step up to the plate, because at the moment, the research funders are behind the curve, many of them. They're still funding things in the traditional old siloed ways, you know, medicine, physics, energy, all in separate silos. And what we need is research funders that actually think in a kind of planetary health frame, so they're actually funding transdisciplinary work that will enable us to understand these burgeoning threats coming over the horizon very rapidly towards us, and how we have to react very quickly in systems-based approaches to really address these threats. So we're running a little bit low on time. Let me invite the panelists maybe to make just a very brief, 30-second, 1-minute brief summary, maybe focusing on kind of one big adaptation issue that's relevant for your region, a priority, and perhaps one mitigation. How would you suggest cutting emissions quickly in your region and benefiting health? So let me, maybe I'll start with you, Robin, to just share very brief reflections.
Thank you, Andrew. I'm not sure that I can satisfy your question. I had one other thing which not regional, but very much not regional. Perhaps I could spend my minute on anyway. We've talked about the urgency of action, and I think we all agree. Coming back to the earlier session that you co-organised this morning, I just wanted to reiterate point from there that there is an additional opportunity, an additional urgency now. We're talking about the economic stimulus post-COVID, for a sustainable recovery, sustainable economic recovery, but of course, sustainable health recovery as well. But there's a great opportunity there. There's a lot of money on the table that can be spent on sustainable recovery, but there is a danger of it being squandered. And that's exactly the point that you made earlier. It's particularly urgent now, not just to address the things that we've all been talking about, but to ensure that there's a wise investment to capitalize on the political momentum. Thank you.
Great. Thank you very much. Carol, let me turn to you just for a very brief concluding statement. You'll need to unmute yourself.
Okay, you can hear me?
Yes, can hear you now.
Right. I'm looking at the health system, mainly the health system. The integration of the various health systems, many of the health systems are not integrated. And one of the things we need to do is to integrate the health system. That is one area, and strengthening the health system as well. This is my early view, but I think most important of all, going through about huge areas in Asia, I think primary care needs to be redefined. This is one of my views. I think you did touch upon it earlier, and I think we need to relook at, because primary care is defined differently in different countries. So I think we need to relook at it and redefine primary care, so that will benefit the whole of the growing threats from the global climate change.
Great. Well, thank you very much. And it's interesting to note that the World Organization of Family Doctors is playing a very active role in the climate change planetary health arena. And it's interesting that they are pioneering some of the work around educating the public and trying to change behaviors and so on. So Jeremy, let me ask you to share your final reflections.
Well, mine obviously, and it's partly related to my background, is modifying agricultural practices. We are part of the problem, and we need to change that. But in changing it, also to think how we meet the needs as it relates to food security, and that again comes back to thinking again on local bases of what, in light of climate change, what are the resources that one can actually effectively grow in an ecologically sound manner that will meet the needs of the local population. And I think we may be having to think more along these lines than the globalization that has always been bigger, more, and do that. I think rethinking that could do an awful lot on both reducing the impact of agriculture on climate change and addressing the needs arising from climate change that come with food security.
Right. Carolee, let me turn to you finally.
Yeah, we only have 1 minute or 30 seconds, so I'll be really short. I agree with everybody. I think everyone's regions are different and we have most pressing challenges. I think there's promise, and Sir Haynes, you mentioned something about planetary health, whether we call it that or One Health, but a systems approach thinking when it comes to addressing climate change and health impacts around the globe, to realize that humans, the environment, animals all exist as one. Earth will be here in 6 billion years from now. We may not be if we don't all work together using the right approach. So that's really fundamental for me.
Well, thank you all very much. On that note, we have to finish. We've run out of time. Let me do so with an optimistic note to say that I think by what we have heard is that by reframing climate change as a health issue rather than purely just an environmental issue, we think that there's an opportunity to increase the level of ambition by involving the public, patients, scientific colleagues, in this discussion, we can raise the profile of climate change as a threat to our health, but also the solution, of course. The solution lies within our hands, and it's about adapting to the change we can't prevent, but more importantly, preventing the change that really we can't adapt to. And I think that is a really crucial challenge, probably the biggest challenge for humanity that we have at the moment. And that means rapidly mobilizing the argument in favor of rapid decarbonization of the economy, using the health argument as a crucial lever to change, but also, I think, ensuring that we meet the aspirations of the Paris Agreement. And in coming up to COP26, which, as you know, is taking place in Glasgow next year, there is this initiative that I mentioned at the end of the previous session called the Race to Zero. And the Race to Zero is the net zero carbon economy, which we have to achieve by mid-century at the latest. And we, I think, are all convinced here that the health argument is an important motivator for accelerating progress, accelerating the level of ambition towards that net zero target. So I'll leave it at that. We've run out of time. Please join me in thanking all the panelists. I think we've had a great presentations, great discussion, and thank you all for participating. Bye.